Yes, you're welcome back again. We are here to make sure that this is going to be a very interesting time for all of you who are watching, because now we're looking at cancer awareness program. We all know that cancer is said to be a killer disease, and a lot of people are saying that it shouldn't be so, because if we look after ourselves, we can avoid, and we can, in some cases, manage the situation such that it's not an immediate death sentence when you hear cancer. To have this conversation with us this morning is the Executive Secretary of the Committee Encouraging Corporate Philanthropy, and that's Dr. Abia Nzelu. Good morning and welcome.
Good morning, sir.
All right. Now, a lot of people hear about cancer, and the moment you say that somebody's got cancer, that's it. Oh gosh, that's the end of that person. How much time do they say she's going to have or he's going to have before he dies? It's almost assumed, it's automatic that that person is going to die within a short time. Now, the program that CECP has put together, what is it all about?
Well, the CECP is an initiative that is private sector driven. It's driven by the organized private sector to tackle major societal needs. And the present focus happens to be taking cancer prevention to the grassroots. And so what the CECP is doing now is to ensure that we have enough resources to acquire mobile cancer centers that will be able to go to the grassroots to take both screening and treatment awareness to the people, so that cancer will no longer be a death sentence as we see right now in Nigeria. Because indeed, cancer is not actually a death sentence. It can be survived. And that's why last Sunday was declared as International Cancer Survivors Day. And it is marked globally all over the world to let people know that there is life after cancer. So even the fact that you have cancer does not mean that that's the end of life. It is not a death sentence. It can be survived. Because according to WHO, most cancer deaths are preventable. 1/3 can be prevented, 1/3 can be cured, and the last third can have good quality of life if it has good care. So it is not actually a death sentence. So the committee is trying to get prevention to the grassroots, because the reason why the problem we have with cancer is not about the incidence, the number of people that have it, but the death rate. In Nigeria right now, out of every 5 people that have cancer, only 1 survives, 4 will die.
So why is our own statistics skewed towards more death rather than survival?
Yes, it is something that is common in the developing world, but it is particularly high in Nigeria. And the reason why it is like that is because we don't have structures on ground to take care of cancer. Cancer is the most expensive disease. So because most developing countries are poor and they don't have the resources, they tend to die. Most of the deaths tend to occur in developing countries, because right now the statistics is that about 70 to 80% of cancer deaths occur in developing countries, even though cancer is a global epidemic. But most of the deaths occur here because we don't have the structures on ground to take care of them.
Tell us more about these structures
exactly
that we need on ground to take care.
Yeah, to effectively take care of cancer, we need to have comprehensive cancer centers. A comprehensive cancer center is a tertiary health institution that is focused exclusively on cancer care. So you have an institution like, say, the Lagos University Teaching Hospital, the UCH, that is focused exclusively on cancer care, of cancer of every different parts of the body. So the focus is just on cancer. That's what we call comprehensive cancer center. Ideally, we should have that for cancer, and we don't have any in Nigeria. So we should have at least 1 in each of the geopolitical zones. Then we should have mobile units too that go to the communities to reach out to the people. We don't have these mobile units in Nigeria too. So in the United States, for instance, some people will say, oh, the United States is a big place, but I'll come down from the United States. In the United States, they have over 1,500 comprehensive cancer centers. They have about 2,000 mobile health units in the United States. Now, if you now come down to a place like India, which is also a developing country like Nigeria, They have over 120 comprehensive cancer centers.
And why is it that we do not have one? Is there a problem? What is the challenge?
We should all answer the questions because
Isn't it we're not aware of how much this is killing the people according to the statistics you're real.
That's what we're trying to do, to let people know about the impact of cancer in our community. Globally, 1 out of every 3 persons will be diagnosed of cancer in their lifetime. Globally, it is not a thing of just Nigeria or developing world, globally. But the unfortunate thing is that we are not prepared.
But
So
we have a tendency to say that by God's grace, I will not be one of those.
Or better still, amongst the 3 of us, since you have said it now,
yes,
so I'm looking around like,
okay,
it's not my
portion.
It's not me.
Not my
It's not
portion.
my portion.
Well, the thing is that everyone is we are pushing the buck to the other person. The private individuals will be looking at government, that it is the role of the government to provide the comprehensive cancer centers or the mobile units. And then the government expects that the private people will do it, or maybe they feel that they have too much on their hands, that they cannot start going into that. And then you find that this buck, passing the buck, and then eventually we don't have these facilities, people keep dying.
But do we have the money? Let me first ask, because sometimes
Exactly.
it could be that, it's too expensive.
Okay, let's look at the cost implication. Now, for comprehensive cancer center, the average one will cost 10 billion naira.
I see.
10 billion naira. Then the mobile cancer center, when I say mobile cancer center, we mean a clinic on wheels with facilities for screening, not just mobile mammogram, because the first thing that comes to people's mind is mammogram. It has facilities for screening, including mammogram, colonoscope, ultrasound. It has laboratory. It has a theater where you can treat the early cases of cancer. And so it takes care holistic cancer prevention to the people. That's what the mobile unit is, and it's about 95 million naira. Now, if you look at what Nigerians spend on treatment abroad, according to the Minister of Finance, Nigerians spend $200 million on treatment abroad. The comprehensive cancer center is approximately $63 million. So you can see that Nigerians, the money we spend on treatment abroad can build 3 comprehensive cancer centers every year. So it is not actually because we don't have the resources that we have this problem. Because actually, with only the money that is spent on treatment abroad, we can build 3 comprehensive cancer centers every year. And if you want to take it to mobile units, you can get 333 mobile cancer centers every year. Okay. So it's probably a thing of priority.
Okay, now when we have that kind of situation, we've got over 700 local governments, and we've got 36 states of the federation, and we've got a federal government. Amongst all those 3 different part of the government around the country, which ones have you approached to say we need help and let us buy this? At least one, for one state, one local government, or even one that is owned by federal government that will move around the country from one state to the other.
Now, we have, this is the National Cancer Week, and it started from International Cancer Survivors Day. So we have, it's a week of advocacy. The last day is Sunday, tomorrow, where we will have a concert with the best of musics. We have the Muzon Choir, the Two-Face Idibia, and some others coming to fight against cancer, to sing and campaign against cancer. And that is taking place tomorrow. And advocacy has been going on. Letters have gone to every level of the society. So nobody will say, no level of the society will say it's not aware. Letters have gone out, and advocacy has been on, and even in the media. So everybody is aware of this situation, and it's not just now. The advocacy about this cancer situation has been on for years.
So how much has been raised so far?
Well, now, the CECP campaign started in 2013 when that was when this mobile cancer center initiative was unveiled. That was February 2013. And since then, advocacy has been going on. And like I said, CECP is co-promoted by the organized private sector, including the stock exchange, IOD, LCCI, and all that. Now, we've been carrying out this advocacy, and there are platforms that have been created, established to ensure, to encourage every level of the society to get involved. For instance, we have the mobile phone platform through which people can give. Now, if you take your phone now and send the word cancer to 44777, you contribute 100 naira. Now, that's a platform through which anybody can give. And
what kind of collaboration do you have with the Ministry of Health? Do you have any?
now, so the CECP is a private sector initiative. That what the CECP is looking at is that the idea behind CECP is that the private sector